Did you know that women going through menopause are at a higher risk of developing a gum disease due to fluctuating hormone levels? Oral hygiene isn't just about maintaining a great smile. It's deeply connected to overall health, and the changes in a woman's body during menopause can have surprising effects on her dental health. Hi, I'm Gaia Lewis, and welcome to the Gaia Lewis podcast. And this podcast is all about women wellness. I'm your host, Gaia Lewis, a menopause wellness advocate and holistic coach, and my mission is to empower women to embrace menopause and transform this journey into a phase of self-discovery and enlightenment. Today, we are diving into a fascinating intersection of oral hygiene and overall wellness with Dr. Amineh, a dynamic specialist orthodontist who has spent her life growing up in this vibrant city of Dubai. After pursuing her dental studies here in the UAE, Dr. Amineh furthered her expertise by pursuing a master's degree in Austria, where she developed a passion for biologic dentistry, an approach that goes beyond treating symptoms to understanding and addressing the root causes of dental diseases. But Dr. Amineh's passion for oral health doesn't stop here. During the pandemic, she became the founder of Yummy Treats for Healthy Teeth, a unique initiative that focuses on creating delicious yet nutritious treats for children, helping them maintain strong, healthy teeth while enjoying their snacks. Today, we'll explore with Dr. Amineh how oral health connects to overall wellness, the impact of menopause on dental health, and the innovative ways she's transforming the way we think about dental care. Whether you're curious about the latest in biologic dentistry or looking for ways to keep up your smile and your health at their best, this conversation is the one you won't want to miss. Dr. Amineh, welcome to the podcast. I'm super excited to have you here.
Hi, Gayu. I'm super excited too. Thank you for having me. And thank you for a nice introduction. I'm here. Let me know if you have any questions.
Like we said, I think we want to talk a lot about oral health, which when we spoke about, it's much more than having a beautiful smile,
Exactly.
right? Could you give us a brief of why maintaining a good oral hygiene or oral health is crucial for overall wellness?
So we think the mouth is a separate part of the body, but it's not really. It's totally connected to all our bodies. So it's a window to a healthy body. If the mouth is not clean, the bacteria are building up. It can affect really vital organs like your brain, your heart, even can be a signs for other diseases like diabetes. And recently they discover if that's not maintaining the good hygiene, especially not flossing. We don't say every day, at least 2-3 times a week. It really helps to prevent Alzheimer in the future. Yes, because the mouth, the bacteria which are building in the mouth, they can go through the bloodstream and affects any organs we have in the body. They can affect your gut, they can affect your brain. So it's really very, very crucial to have healthy mouth to maintain a healthy body.
Yeah, and of course, a healthy smile, and you probably
Yes,
smell good as well, right? And you don't keep
exactly.
people away. During your practice, what are the most common dental issues that you encounter, and what are the potential effects on general health?
Actually, the two most common issues we see, and the peoples are coming most of the time, is a dental tooth cavities and gum inflammation. So these are the two main issues we are facing. So when they are coming for the checkups, we see few cavities in some people, and then some people that are coming because of bleeding while they're brushing. So which is the first sign of gum inflammation. But the rest are if the tooth cavities are left on themselves, if the people doesn't have pain, which usually happen, then it can reach to the nerves tissues and the blood vessels of the tooth, and the tooth is only part of the body cannot be treated by antibiotic. That's why we do root canal treatment. So while these tooth cavities get deeper and reach to the nerves, then we have to do a root canal treatment, which removing all the nerves and blood vessels, whatever they are infected inside, and then treat them with the root canal.
So, root canal and gum inflammation. Why do you think gum inflammation happens? Is it because of not keeping, you're not brushing or over brushing? What would be the reason that gum inflammation happens?
Usually it's not proper brushing every areas of the teeth. So we might miss some areas, and then those areas which are missing every day, the bacteria are going to build up, and then tartar or hard stones things, if you have seen it, we call it calculus or tartar. So they're going to build up and they can go under the gum and we don't see it. And then by the time the gum react, they're going to recede, and then they can bleed. But overbrushing, no, doesn't affect, doesn't make doesn't cause gum inflammation, but they can cause gum recession, which means the gum is going down to the level it should be. They are going further down. Regarding the other issues, there can be some genetics factor. They can also cause gum inflammation in genders. Like for women, if we want to consider when they get pregnant, the hormonal changes, they can cause again gum inflammation. If they miss proper oral hygiene, they are more prone to having gum inflammation.
Very interesting. So you're saying that, like when we get pregnant, the hormonal fluctuation levels are there and it leads to gum inflammation. So it kind of leads me to this question that during menopause,
Yeah.
when again these fluctuating levels are pretty
Yes.
high in women, are they again prone to the same symptoms, or are there more complicated ones to look out for?
In menopause women, it will be different. So due to the hormonal changes, there will be symptoms of dry mouth. So these dry mouths, again, it can affect your gum and can affect your teeth. We can treat them. We can advise them drink more waters and have sugar-free chewing gums to help to increase those saliva in the mouth. And there are some other supplements they can get on the side, which is vitamin K2, which most of the people not aware of it, but it's really helpful to increasing the vitamin D absorption in the body, and calcium, which we want for a healthier teeth, not the gum, but for healthier and stronger teeth to prevent those tooth cavities due to dry mouth.
And dry mouth is, you're saying, is due to lack of saliva production
Due to hormonal change,
due to
but
the
then it
yeah.
affects your salivary flow. Then the saliva is getting less in some periods of the menopause. Then they can be a risk for gum inflammation, but mostly tooth cavities due to not having enough because our saliva contains lots of good minerals, which is flowing around our teeth. And when the teeth are getting the acid attack, so it can helps to make them more stronger into acid attacks. Yeah.
So what can people do? What is the hygiene practice that everyone, including the menopausal women, should follow to maintain a good oral hygiene?
I start with the basic, which everyone knows about it, which is brushing, flossing, and tongue scrub. About the brushing, I see the people do this mistake, which is when they are having something sweet or when they are having their meal, immediately they go to brush to get rid of either sugary things on their teeth or the food which are stuck there. This is wrong. Please wait for 20 minutes and then go for brushing. Because when we eat foods or even the sugary treats, the pH of mouth drops into acidic level.
Yep.
So the mouth it's acidic for a period of 20 to 45 minutes, which is depends on your oral hygiene level. Some people gets back faster, some people gets back later. So we want during this period minimum 20 minutes, wait your pH become neutral, then go for brushing and flossing. This is the basic thing we usually say 2 times a day. You brush and do flossing once a day, and usually flossing we recommend to do it before brushing.
Okay.
So that between the teeth are clean, and when you use the toothpaste and toothbrush, then they can also reach the good minerals can reach between the teeth also. Beside that, the tongue scrub is really recommended because we have a bacteria buildup on the tongue once a day. But one thing that people usually get wrong about it, it's using daily mouthwash.
Mm.
The harm about the using mouthwash every day, it's they kill the good bacteria also. We have the bad bacteria and good bacteria. So if you're wishing to do some mouth rinsing, we recommend either coconut oil pulling, which is kind of the holistic or biologic dentistry. They recommend that. Some people they don't like it, but some people they like it. So you can go for that, or you can boil water, let it cool down, and then use sea salt water or Himalaya water salt, which is good salt quality, and then you can rinse if you want daily. That's fine. Beside all these things I mentioned, to have a good, as I said, good hygiene, check mouth breathing. If you are breathing from the mouth during your sleep or during the day, first figure out what is the problem. If you have any ENT problem, if you have a nose blockage, please address that and solve that issue. But if it's that habit, so the solution gonna be a mouth tape. So you can order it online and then use it during the nighttime while you're sleeping. So keep the lips together and then prevent those tooth cavities and gum inflammation.
I think my husband would want to buy it for a regular day purposes, not just for the night. He's like, mouth tape? Yes, I'm going to order that right now.
Yeah, but he has to work and talk during the day. He cannot keep them together.
Very, very interesting. I like the fact that you brought the topic about mouthwash. And I'm as a health coach, I'm very, very against people using Listerine, because
Yeah,
it kind of just kills the bad
the the
it
good
of course kills
bacteria.
the bad, but it takes away your good bacteria as well.
Yes.
And people generally talk about microbiome only of your stomach, but we
Yeah,
actually have a living
exactly.
microbiota even in our mouth, which is very interesting. Leading on to this question, are there any specific toothpaste that people should use? Because do toothpaste also harm, and do they kill the good bacteria?
No, they don't kill the good bacteria. So toothpaste was an accessory in the past.
Mm.
We did not have anything as a toothpaste in the past. The foods were very crunchy. So even the ancient people, they were not brushing. The hard and crunchy foods help them to scrub all those bacteria and plaque. But now we introduced this one plus toothbrush. The about the toothpaste, some people are against fluoride
Yeah.
ion. So what they can do, what they can use, the other recommendation is to go either without fluoride, which is I don't recommend that, or buy some toothpaste which has hydroxyapatite. Hydroxyapatite is the same mineral we have in the bone and the teeth. In case even if they swallow, it doesn't harm. It's like you had some food, I mean, food, what we say, bone broth,
Yeah.
kind of that. So
Okay.
there is no harm. And if you are against fluoride, then you can switch to toothpaste has hydroxyapatite. Yeah, any question?
Are there you spoke about oil pulling, and I really like that fact, and I think a lot of celebrities have made that very popular as
Yeah.
well. Is there any other dental care which is probably not on an everyday basis, but maybe once in 15 days or maybe a month, that you do to just make sure everything is perfect?
Yes.
Uh,
So the other accessories we can have it as option, and as you said, you can change the container. I will explain, which is water pick or water jet. It's kind of electric tooth flosser. So for who doesn't want, they have very tight contact, or they are lazy in using the floss, they can switch to the electric tooth flosser, and in that container they can have bicarbonate soda, as you said, maybe twice a month, which will be every 2 weeks. That can be helping for controlling those probiotics and those microbiome we have it in the mouth. Otherwise, no, that regular checkup that can be fine for them.
my question would be like regular checkup. You mentioned that.
Yeah.
How often should people come to a dentist to
Yeah.
get the check? Or should it be like, oh, only when the tooth pain takes, it's so bad that you can't live, is when you knock on a dentist's door?
Definitely not. So it really depends. We cannot say everyone, they have to, usually we say every 6 months, but that's not for everyone. Depends on your risk level for tooth cavities and gum inflammation. So we have two factors: how often you're getting cavities and how often you need to do cleaning for your gum and teeth. And this will be decided by your dentist, which knows your records and your history. We have three categories of people with different timing. The first one is a high risk people. They have to visit the dentist every 3 to 4 months for cleaning and checkup. The other one, which is moderate, who are at the moderate risk, they can visit us every 6 months. But then, who are at very low risk, not getting cavities every year or every 2 3 years, so every year will be once a year will be more than enough for them.
Okay. So once a year is mandatory to get your,
Yes,
your tooth cleaned, and, and
exactly.
get it checked. But when now leading on to menopause women, so, the whole perimenopause
Yes,
phase is a long period,
yeah,
unlike not one day and you're like, hey, I'm
exactly.
done with it. Uh, should women, is a 1 year at that time still okay, or do they need to come more regularly?
For the menopause, we want to recommend them every 4 months for the beginning, and then see how is as I say, the salivary fluid is very important for us. How is the gum reacting? Because as I said, not everyone are the same. So maybe the first year, the first 2 years, we want more regular checkup. Once a year, no, we don't recommend. And usually every 6 months it will be fine for them.
Okay, so
Yeah.
perfect. But are there any preventive measures that menopausal women can take to
Yeah.
avoid having this issue, or even gum inflammation for that matter?
Yes, if the diet is not changed,
Uh,
if they have same diet and healthy diet, so then it will be about um, what do you say? I forgot.
any preventive measures that they
Any
can?
preventive measure. It will be the vitamin level checkup.
Okay.
I usually recommend them to go for magnesium, calcium level, vitamin D, vitamin K, and probiotics. So we have some tablets in the biologic dentistry that they recommend different brands to maintain that probiotics. As you said, they can depends. We can prescribe for them if they really need that to balance the bacteria in the mouth. Otherwise, only the vitamin levels and what they are doing with the basic oral hygiene. And as I recommend, sugar-free chewing gums. It really can help them, and drinking lots of water to prevent. Yeah.
I like how you're giving me hints for next questions.
Yes.
Um, Talking about sugar,
Yes.
um, how bad is that for oral hygiene? I mean, I hate sugar from for what it does internally, but
Mhm.
I want to see what does it do to the first contact. Like our mouth is like the first contact that food comes to. What does sugar do there?
Yes. So I was very, as you are very, you hate the sugar, but I was curious about the history of the sugar.
Mm,
So since 16th century, the sugar will become was very common. Before that was not, and even the cavities reduced when the World War II happened. The Second World War happened in the world, so it gets reduced because the sugar availability was reduced in the with the people with the families. So it really affects getting tooth cavities. Why it's really harmful for the teeth is the simplest starch in the environment that
yeah.
the bacteria in the mouth can directly consume that and produce acid. In a way, if I want to say, so while I was studying how the cycle of tooth cavities is happening, it was like when you just have even 1 grain of sugar in your mouth, immediately the pH of your mouth drop below 5.
Mm,
And then the bacteria in that time, they are producing the acids. And this cycle, it gets again 20 to 45 minutes to go back to the neutral pH. And imagine if the people in the morning having a cup of coffee with sugar, and after 1 hour, they are getting their breakfast. After 2 hours, they are getting a tea or coffee with the biscuits.
mm,
Again, at 1 o'clock, they're going to have their lunch.
yeah.
At 3 p.m., they want a snack. So just count it. If it's more than 3 to 4 times acid attack in your mouth, then you are prone to getting cavities. It's not only about the sugar, which is the white sugar or brown sugar. They both are
Yeah.
same. But some people, they think brown sugar is more healthier. Some benefits it doesn't
Yeah.
have. They just mix some molasses with the white sugar. But the bad thing about the sugar, just have something sweet and sugary things, and then roll your tongue around your teeth before and after. Immediately after having something very sweet, you can feel your surface of the teeth getting rough. And it's
Yes.
not anymore smooth, and then you can feel it and you can see it what's happening in your mouth when you're having something sweet. But then it's about frequency also, as I said. If per day you are going to have so many sweet things, not only sugar, even the healthy stuffs
Yeah.
like
Yeah.
fruits. If you are going to have 4 fruits, we say please divide it 2 times a day. Don't make it 5 times per day to minimize this acid attack. So we have to be conscious about the acid attacks. We are doing it every day. And what kind of sugars we are consuming. As I said, the white sugar is the simplest one, and the bacteria can immediately convert them into acids.
That's
Yes.
very, very interesting aspect to understand. Very, very interesting. Um, with the hormonal changes, you mentioned about dry mouth. Are there any other risk of dental problems apart, like risk, like proper risk? Will women start having their teeth that starts falling, or what can go really wrong?
No, I don't want to scare the people who are getting their menopause or their pre-menopause. No, not really. Mostly the hormonal changes, which is very fluctuant, it is happening during pregnancy. During menopause, the most common sign is that, as I said, and just check with your daily vitamins. I think you have to increase and change the vitamins that you're taking as a woman when you're getting into near close to menopause, and those vitamin supplements also can help with your healthy teeth in your mouth. And just keep the same hygiene you had. Don't miss, don't be lazy. Maybe the mood is changing and the woman just missing some, I don't know, flossing per day or brushing. So no, if we have that good hygiene, then and that habits routine is happening every day, that should be fine.
Are there any particular food or a diet that can help promote oral hygiene? That, with the microbiome that's there in the mouth, is there something that we can do to help them be at their best?
Yes. So I again go back to the tooth cavities. If you are going to have something sweet, if it's occasionally you are going to have a dessert or something outside, if you have a cheese in your table, take some cheese, especially the old cheese, helps to immediately increase the pH of your mouth, and then or drink some glass of waters. And ask me a question again.
So any diet that can help promote dental hygiene, which is good for our microbiome.
So the crunchy things, like crunchy vegetables, is really recommended. Crunchy fruits like pears, apples, carrots, they are really recommended. Nuts, definitely, they have really good vitamins, which helps with the strength of the teeth. And butter, we don't miss the butter. Don't say it's because of the fat or no. They have really good vitamin A and D, good source of vitamin A and D. Try to find, if you are having dairy, like butters or cheese, who I mean the cows are they are grass fed, so this really recommended to go with that. And if you can have bone broth, it's really good. If you are cooking some stew with the beef, please have the bone inside, especially for who are younger, the little ones.
Just again, what can the vegans do?
Yeah.
They can't have the bone, they don't eat the meat, they don't have the grass fed
Yes.
butter or the cheese. Are they lacking on something, or can they substitute? Is coconut milk almost as good as cow milk? Especially, I'm talking about teeth. Is it good as a substitute, or is there something else that the vegans can do?
Yeah, it's really hard to say, but we'll ask them to have the supplements. As you know, the vitamin D, magnesium, calcium, they have to get vitamins if they are not getting from their food source. But like coconut milk, it's very good, but still lacking some vitamins. And dairy, so not everyone can have milk every day, and we require for a specific age of the. So for like little ones, we don't need it to have milk for, but the other dairy like cheese or butter, I really recommend. But then I'm not a vegetarian, but I'm sure if they know better than me. So what kind of plant foods they have these vitamins? If you are not receiving and you check your blood test and still some vitamins are lacking, please for sure take some tablets as a supplements.
Leading on to my question was exactly this: that are there any specific supplements that we should look at incorporating for oral hygiene?
Mostly vitamin K2, if
Mm.
the people can find it, and this is the best, and magnesium. These two we usually missed it, and we think we have vitamin D, that's enough, or we are missing the calcium. But no, vitamin K2, no one is recommended. Even who are the pregnant, we usually recommend to get that for better bone developments and jaw developments for the babies. As and magnesium, these two, even the magnesium, the good thing, help you with a better sleep and help you to reduce the craving for sweet. It's just
So it's a
recently
win-win.
discovered. Yeah, it's a
Yeah.
win-win. Yes.
Oh, amazing. Are there any, widespread, uh, you know, uh, myths when it comes to oral hygiene? There's some people say that, you shouldn't brush in the morning. Let
Mhm.
the whatever stuff is there that's in
Is
your
there?
mouth. It's very, very good. Have water on an, empty stomach. Don't brush in the morning. Are these really myths, or actually there is science backing, these practices?
No, for these, as you say, the water with the empty stomach, that's fine. But some people are taking the water, lemon, and maybe some ginger, or only water and lemon, because it's acidic. We don't recommend. Either they have to reduce the amount of the lemon drops they put in their water, or drink lots of water afterwards. Regarding the misses, so like when they have pain, they are going to the pharmacies, getting some clove oil, which is very famous and common, but it doesn't treat the pain at all. And they might put the cloves itself beside the tooth to relieve that pain, but it can cause necrosis, or it can cause necrosis, means death of the tissue death. They
Ooh.
can yes, exactly, they can cause damage to their gum. Or using the baking soda to make their teeth whiter, no, really, not really, it doesn't happen. Not brushing before breakfast, we don't recommend. We usually recommend brush before breakfast. Some people, they say it's before or after. We recommend to be before, so then the mouth is clean, and when you are getting your breakfast, so the level of the acids will be less, the bacteria, the load of the bacteria is much less. Because when we sleep for 8 hours, the mouth, the salivary flow, it's reduced already. So when we wake up, so we recommend for better breath and freshener breath, first brush your teeth and then go have your breakfast.
You spoke about the whole water and lemon, and it said it increases the acidic level. Is there What happens with that high acidity? Does it start corroding the teeth, or does it cause, what causes those specific white lines that happen on the teeth? Is it because of this high acidic?
The white lines, no, it's not because of that acidic, but there can be erosion, as you said, eroding the good minerals of your teeth. So it doesn't matter you eat sugar, even which cause acidic attack.
Yeah.
You can have acid attack directly by lemons, or very citrus fruits, or soda, or soft drinks. They are all are acidic. So then these acids, if you do it every day frequently, then the good minerals go away and your teeth get yellow, especially from the inside. Or who are having vomiting every day, if they have symptoms. So from the inner side of their teeth, the enamel or the first layer of the tooth, it's getting weaker and weaker, and by the time it's gone. And they have very sensitive teeth in the beginning, and then again, there will be other consequences happening.
It's very interesting. There is a very famous French biochemist called Jessie Enchampé, who's popularly known as the glucose goddess.
Yeah, I know
You
her.
know about her.
Yes.
And she has this whole hack of having vinegar before a meal because it helps in reducing the sugar spike a lot. So what is your take on that? Because she really recommends just taking a shot of apple cider vinegar and then having that, so that no matter even if you have a slice of cake post that, because of the vinegar consumption, the sugar spike doesn't happen at all. I want to
Mhm.
have a take on a dentist's opinion on that.
So vinegar definitely is acidic. So uh, depends on what is the situation the people are suffering. If it's diabetes, they want to control by this. I see she has also a formula, a tablet that
She's come up with a
anti-spiking.
tablet
Yeah,
now, but then
the tablet is more safe than having if they put something in that tablets, and we are swallowing, so we don't expose that vinegar or acidic things in the mouth. I don't recommend, but depends if they need to have it. Then be very careful and mindful. Then have something that the pH of your mouth should be reversed into neutral, like as I said, cheese,
mm,
or get some crunchy nuts to increase increase that salivation, or sugar-free chewing gum. They can have it, so they have to neutralize that acid level which is happening.
interesting. When we but imagine we do this and then we brush post 20 minutes. Would that counter effect the vinegar attack, or would it be okay?
No, that the 20 minutes if you wait to brush, that's safe. That is safe. But the no, it doesn't counter. It's already
The
the acidic.
damage is done.
Yes, the damage is.
Okay, very interesting. So, would you recommend brushing post lunch as a, just to make sure that we all have known about
Yeah.
the thing that a dentist always says is make sure you brush in the night before you go to bed.
Yes.
But is brushing post lunch also necessary? And if people don't have the time, what else can they do?
So 2 times a day, it's a recommended one. So if you missed after your lunch, that will be fine. Just rinse with some water if you have, or drink some glass of water if you. Then that should be fine. We don't need to be very worried if I didn't brush after my meal. But if you are taking care of the good oral hygiene and we are mindful of what we are eating, so I say like brushing and flossing, it doesn't prevent 100% tooth cavities. It's also about what we are eating and how we are eating, how many times per day, and what we are eating. So being mindful, it's more important than if you missed once a
What?
day.
Yeah, okay,
Yeah.
very interesting. I just wanted to, we've spoken so much about oral hygiene and
Yes.
health and stuff. Um, Having a dentist create healthy treats, it rings a lot of bells in lots of people's head. Can you tell us how you came up with this idea of creating yummy treats, which is actually not bad for your teeth?
Yes. So before the COVID, I was visiting lots of kids, the teenagers, so they were getting lots of cavities, and I always was wishing, so what can I do for them? And whenever I was asking, what is your favorite snack? They were telling me like I will have like a chocolate bar of Snickers or Galaxy or whatever, or we love soft drinks. So I said, okay, during the COVID happened and I was baking at home and I thought, okay, what can I make healthy, not only with sugar, so to be beneficial, especially for the little ones. Then I remember we have different kinds of natural sweeteners in the dentistry, but it was not recommended to use in a huge amount as a baking. Then I research and figure out, okay, there are some kinds that I can use it in a specific amount and which is good for the teeth, and how it works actually. So they sweeten my treats, cupcakes, and bites, but the bacteria in the mouth cannot convert them into acids. So the structure is in a way that they cannot break down and produce the acids. So then I made these cupcakes and bites when the people are eating, especially the little ones. So your mouth pH doesn't fall into acidic level. And beside that, the ingredients I'm using, they are nutritionists, they are healthy. So I came up to give an alternative option, especially for the little ones, for the parents to have peace of mind, always looking for something sweet, but also to be healthy. That's why I came up with the snack and smile.
Amazing. So why only children? Why not the adults? Because I think anyone likes to snack, and something
Yes.
sweet is always, I think, makes people happy. Although I don't think it's the right thing, but
Mhm.
it does make people happy. So why not
Not
The adults,
the
yeah. Why
adults.
leave them?
No, I don't leave them. They when I offer them and they try, they said, "Okay, we want to also have." For myself, I said, "That's okay. You can have this sugar-free stuff." But why I started with the children, because the little one, 2 years, 3 years old, it's really hard to sit them on the dental chair, and most of them getting tooth cavities, and they are who are younger, they go under general anesthesia. So yeah, to prevent that, or at least delay the tooth cavities in children. So and as you know, they are exposed to so many varieties of these sugary, yummy snacks in
Yeah, yeah,
the
totally. As a
market.
mom of two, I say, I can say yes.
It's hard to say them no,
Yeah,
don't eat them. So that's why I create and I say, but they still the parents, they love it and they use it as a sugar-free treats for themselves too.
amazing. You said that you use specific sugars that doesn't cause the acidic buildup.
Yes,
I use a lot of non-sugar stuff as well. But I have a question. Monk fruit, which
yes,
is one of the zero
yes.
calorie natural
Yes.
sweetener, is does it fall under this category of no acidic? It doesn't cause the acidic reaction, or is it also same as a regular sugar in terms of acidic reactions?
No, it doesn't. It doesn't follow your acidic
Okay.
pH level. It's totally safe. But the daily usage for the children should be very limited according to their body weight. But it's very safe. Yes.
Yeah. So because it's kind of mixed with erythrol, right? In
Yes,
general, to have it
exactly.
in a
Yes,
more
it doesn't follow your acid. Yes,
interesting, because I do bake a lot with
it's amazing.
monk fruit, because I'm a non-sugar person. But yeah,
Oh,
different
perfect.
alternatives. But then yeah, just because since you just mentioned about something which is
Yes,
does I had to ask this question. In the back of my head, it was like.
sure. Yeah, that's the best
Uh,
alternative.
if our listeners, want to learn more about, maintaining their oral health, are there any resources that you recommend?
Usually, the main goal in the dentistry, like for us and for even the other individual, it's a American Dental Association, which is ADA, and then the other resources, the like most reliable articles if they want to figure out. Sometimes there will be some news about different things, but it's very new. Then they can go to PubMed. And then there will be in Dubai, we have Dubai Health Authority. But what I figured out when I was researching, so in the Canadian Dental Health Association, I found very good resources for the people if they want to figure out in the Australian Dental Health Association and UK and ADA. So if they want to know new things about dentistry, and please don't Google whenever issues they have, and because the Google doesn't give the right answer. Either you consult with your dentist or go through these resources.
Amazing. I have to ask this one question that you're talking about. What is your take on the regular toothbrush compared to these electrical toothbrushes? Are they better?
So I use electric
Uh,
toothbrush to be honest. I was using the manual for many years, but then when I switched to the electric one, I'm really happy because I don't miss any areas, and the smaller head helps me to concentrate more on each tooth. And my toothbrush is showing the timer, so whenever I'm doing the 2 minutes, it's showing me happy smile and happy face. So that's kind of motivations, and I know it's 2 minutes is done. So I usually recommend electric toothbrush, especially for who are coming and they have many missing areas of brushing.
I said I had to ask this question to a
Sure.
dentist. Dr. Amina, where can our audience find more about your work, your dental practice, and of course, more about the healthy treats?
Thank you. So I have a Google business profile. If they search my name, Dr. Amineh Razavian, it's quite hard. The name, the family name. And also, I do have my Instagram, social media. I have two pages. One is Dr. Amineh Razavian, and the other one is a Snack and a Smile. Snack and a Smile, just remove the K from snack, dot and dot smile. And also we have website. I'm uploading 2 free guides there. It can be helpful for adults and for kids. So you can download it for free and use those information.
Amazing. Um, before we wrap up, there is, this podcast is all about women wellness. Everything we talk about is women wellness. But we know that there are men in our lives.
Yeah.
So it brings us to this segment called the 1%. Because what is your advice to the men in our lives? What can men do better to support their women going through menopause or any big lifestyle change? How can men support women better?
Just understand the different mood the, the women are going through, but it's all about understanding each other. I believe in that. It's a hard question. I know the hard situation. Sometimes we all of us have hard time in the life, but don't point just understand, especially women, because of very fluctuations in the hormonal level. So the mood is really affected easier than men. So just study more and know more about women.
Thank you, Dr. Meena. It was absolutely fantastic knowing about oral hygiene and the different holistic, practices that we can do. And thank you for letting people know not to use a mouthwash. I've been trying to get that message through, but thank you. I'm happy that it came from an expert.
Yeah, that was in my mind, not to forget to mention this one. Yeah, just be very mindful. In case if your doctor prescribe you for 2 weeks, 10 days, that's fine. You can use it, but daily mouthwashes is not really recommended.
Brilliant. That's a wrap for today. I hope you all had an amazing time and now you know what goes behind keeping a beautiful smile. Until next time, menopause, why pause? Let's play.